Good day, everyone. Whether you're watching us in the evening or whether you're watching us during the daytime, I, as well as the board members from Charms Medi Helps Foundation, say thank you again for tuning into our Black Health History Month event. This event is being brought to all, but especially our Black community, because we need to know when it comes to our health and it comes to the options, we need to know and we what's out there. We need to know who it is that we can turn to that would not only listen to what we say, but that would understand the problems that we're having in accessing care, the problems that we're having in not being heard when we go to the doctor's office, or our families being heard, the problem we have with accessing what's been going around for years and years and years. Every 10 years they have this thing called healthy people. Well, right now we're on healthy people 2030, but healthy people 2010 and healthy people 2020, they had some of the same factors and they weren't addressed. So they keep bringing them up in hopes that they'll address them. They keep bringing them up. And when I say they, the powers that be, keep bringing them up without actually having insight and foresight from, of all people, the patient. And so we're here as an organization to make sure that voices get heard, that resources are known, that options that patients have are available to them. And so, with that being said, we have another speaker who is just dynamite. When I say dynamite, I say that with all caps. That's how bad this sister is.
Oh, thank you.
She has a number of things going on in her world. She is a cancer doula. I'm going to let her explain to you what a cancer doula is. I'm going to let you explain to you her reason for doing what she does so that you'll understand. And she, by the way, she's going to actually tell you all how to get in touch with her when she's done, because she's looking to help as many people as she possibly can in the spectrum in the role that she covers. So, with no further ado, I'm going to go ahead and turn it over to the beautiful Talaya Dendy.
Thank you so much, Miss Sandra. I am so honored to be here. This is just amazing. Thank you for doing this, for highlighting so many beautiful, amazing, and smart Black and African American people. I am a cancer doula, as Sandra mentioned, and I actually became a cancer doula because of my own cancer experience. In 2011, I was diagnosed with Hodgkin's lymphoma out of the blue. And I say out of the blue because I was never really sick before. Other than the flu or a cold, that was it. I never broke a bone, stayed a night in the hospital, nothing. So I was what you would consider very healthy. Well, in 2011, actually, I'm going to back up, 2010, I went to my primary care doctor because I noticed a small lump on the side of my neck. I was very active and working out all the time. So the doctor just blew it off and said, "Oh, it's probably just a pulled muscle." Well, that pulled muscle got bigger and harder as time went on. So a year later, I went to a different doctor. It's important for me to note that this doctor was a white woman, the first one. A year later, I went to a different doctor who was a Somali doctor, amazing woman. And after my physical exam, I pointed out to her the lump on the side of my neck. Totally different response. She asked questions, she touched it, she just seemed really concerned and inquisitive about what's going on. So of course she asked me how long it had been there, all these other things. The more we talked, I could tell that something was wrong, but I did not think it was going to be cancer. She said, "Well, Talaya, what I want you to do is as soon as possible go in for an ultrasound." Went in for an ultrasound a few days later. That came back inconclusive. However, I could tell by the technician's face that something was wrong, but she wasn't at liberty to say what that was. So got the results. That came back inconclusive, and they wanted me to go in and have a fine needle aspiration. That is where they take a small sample size of the tissue from that area. Unfortunately, that came back inconclusive. On to another test. So finally, I had a biopsy of that lymph node in the area where it was swollen, where the tumor was actually, and that came back. I got a call on a Friday. On my way, driving on my way home from work, the nurse said, "I'm sorry to inform you, you have Hodgkin's lymphoma." And I had to pull over, of course. And I'm like, huh, what? What is that? So she explained it to me in a very high level. I had all these questions, of course, like what is that? How did I get it? Where did it come? Just all these things. And she stopped me and she said, "Honey, I'm so sorry. I know that you're concerned. However, you have to wait to, talk to a doctor, to an oncologist to get more details. And your primary care doctor will get back to you on Monday and help you set all those things up." But her words of encouragement were, "Honey, I'm sorry. I can tell you that my husband had Hodgkin's lymphoma years ago. He's doing phenomenal today." Well, that didn't really help me at that time because I wanted answers. And who calls somebody on a Friday evening when they can't talk to anybody? And so it was just this whole sense of uncertainty, worry, seeing my life flash before my eyes that happened. And so I will fast forward now to meeting my oncologist, my healthcare team, after being initially blown off by my first primary care doctor. Once I knew how serious it was that I actually had cancer, I became an advocate in that moment. And I actually share with my doctor that, basically I'm a participant in my care. We're going to have a discussion. It's not going to be, this is what you're going to do. I'm going to have a lot of questions and I'm going to need you to answer. For my first oncology appointment with him, I came in with my notebook, my pen. I had no idea, what things were going to look like in the future, but I knew that I had a lot of questions that I needed answered. And so from that moment on, he was very respectful of how I wanted our partnership to look. He honored that. And we had a really great relationship as far as patient and doctor. I'm very happy that I was blessed to have him as my oncologist because he saw the value in me. He saw me as a human being, and he saw that I was really serious about taking charge of my health and my quality of life. Now, I do want to explain that Hodgkin's lymphoma, for people who do not know, is considered a blood cancer. And there really is no definitive cause of Hodgkin's lymphoma, but it is classified as a blood cancer. It typically affects younger people or older people. And so that's just something I wanted to put out there about Hodgkin's lymphoma. So, because I had a great oncologist, my healthcare team was fairly good, there was still a lot of gaps in my care. And by that I mean there wasn't a lot of emotional support. I had attempted to go to a support group. I was the only Black person there, I was the youngest person there, and everyone there was very negative. Those three things just did not agree with my spirit, my soul. I wanted to live. And so my cells were screaming, "Let's get out of here." And so I left. And because I was not able to find that support that I needed and that I was looking for, I just started researching all these other things. How do I support myself? And I started learning about meditation. I started learning more about the importance of journaling. Of course, I always prayed, but I created a healing journal for myself. I would watch different videos, just always listen to words of encouragement, positive affirmations, and that's how I took care of myself emotionally. Of course, I reached out to select family and friends who also gave me that emotional support. However, as well meaning as they really didn't understand what I was going through. And that's the key difference. And so, because I had a great healthcare team, but I still had all these other needs, I said, if I had a great healthcare team and I still have all these needs, what about the people who don't have a great oncologist or a supportive healthcare team and they're not getting the emotional support that they need? So that is why I started my organization called On the Other Side. And what I do, let me tell you what on the other side means first. Actually, I call it on the other side because most people hear that. What do you think? Death. Oh, she's on the other side now. No, my organization is called On the Other Side because I want people to know and understand. And I'm a witness, I'm a testimony that there is life on the other side of cancer. And not only that, you get to choose what that life looks like. When your health is impacted with cancer or other serious illnesses and diseases, not only is it a time to heal physically, it's a time to heal emotionally, spiritually, and any other areas of your life that may need some attention. And so I call it On the Other Side because on the other side of cancer and cancer treatment, there's still life. There are more survivors of cancer now than ever before. That's amazing and blessing. It's a good thing. However, our healthcare system is not designed even today to effectively and efficiently support survivors like myself. That's a whole different conversation. So that is why I call my organization On the Other Side. And as a cancer doula, what I do is I support and guide and walk with my clients on their cancer journey. I make sure that every area of their whole being is being taken care of. A lot of people are depressed. A lot of people feel lonely. A lot of people feel unheard, misunderstood. They feel like a burden. And so I support people in those areas. I'm not a therapist. I don't have a license to be a therapist, but I have lived experience. I can really relate to how someone with cancer may be feeling. I have empathy. All of those things are important. Just listening to someone, letting them voice and share their opinions, their concerns, that is a very therapeutic and healing thing that you can do for a person. Now, not only do I focus on the emotional side of cancer, but I also focus on helping my clients to understand, well, number one, what kind of cancer do you have? What does that mean? What does that look like? How can you best take care of yourself? If they're interested, what clinical trials are available out there? These are all things that if you don't know what is attacking you, how do you, in a sense, put yourself in a position where you can best defend yourself from this thing? So, a lot of people don't even know really what cancer is, how it works, how it mutates. People don't understand that. A lot of people are afraid of looking into clinical trials. It doesn't mean you have to do a clinical trial, but just know what's available to you. A lot of people are not knowledgeable about how to eat effectively when they're undergoing cancer treatment to boost their immune system and help improve their chances of recovery from cancer. There's just so many different things. Communication. That's another big thing. People have a hard time communicating with their family, their friends, their employer, and vice versa. For example, a lot of times when a cancer patient has a caregiver, and it can be their spouse, sometimes their communication shuts down because the cancer patient doesn't want to be a burden and the caregiver feels guilty because he or she feels like they're not effectively supporting their loved one. And so there's this breakdown in communication, and I help with that as well. And so the four key areas where I support my clients are: number one, emotional support and mindset. Number two, helping them to understand their treatment options and learn about what other options are available to them, as well as getting a second opinion. Yes, you are entitled to a second opinion, and I think it's a must. The other area that I help people is with, high level nutrition. I'm not a dietitian, but there are some key things that you can do to help boost your immune system while you're undergoing these cancer treatments. The the other thing, the other part of that too is understanding what else is out there in terms of complementary therapies. There are still a number of people who are not aware of different complementary therapies that can help offset the side effects of cancer treatment. Some of those might look like yoga. Some of those might look like meditation, tai chi. So, helping my clients, number one, understand what's out there and learn about what may be best suitable for them. The fourth piece is communication. That, as I just mentioned, communication with their loved ones, their family, their friends, their employer about their cancer. And I think communication is important because it's very uncomfortable for both parties, the person with cancer and the person who may be in that person's life in some way, shape, or form. A lot of people, they get uncomfortable and they just blurt out will things. Oh, you don't look sick today. No, you don't want to say that to somebody with cancer, you know. So just making sure that when clients are in those situations, they know how to best handle and take charge of those conversations so that they're not walking around feeling bad about themselves, feeling depressed, anxious, that kind of thing. So, helping them to ignite their power, helping them to prepare scripts. If they're going to an event, you know, hey, let's get this script together so that when someone comes to you, you can take charge of the conversation and you can discuss and talk about the things that you want to discuss where the conversation isn't just on the cancer. And I think that's really important for a lot of people too, because they don't want cancer to be the center of the conversation or attention every time they go somewhere. And so, those are some of the areas that I help people with. My services are very personalized to my client's need. Some people may need to have more time with emotional support and mindset and affirmations and just talking about what they're feeling. Some people may say, hey, Talaya, I want to know what else is out there about complementary therapies that can help me with sleep. Okay, let's work together and find out what works best for you. And so it's very personalized. I do want to say that I am a board certified patient advocate as well, and I have a coaching certification. And I know a lot of people get hung up on titles and certifications, but to me, what trumps all of that is my lived experience as a former cancer patient, and now an 11, almost 12, almost 13-year cancer thriver. And so I understand how someone may be feeling and what they're going through. And I just want to note that my website is called ontheotherside.life because of what I've already shared. So, .life. And if you are interested in talking with me, you can set up a 30-minute meet and greet, and we can just talk through what your challenges are and talk more about the kind of support that you're looking for. And then I can explain how I can support you if I can support you. If I'm not able to support you, I will help you find someone who can.
And Talia, I want to say thank you so much. I also want to say, please keep fighting. Please keep helping those of us that are in all communities, but especially African American communities. Please keep helping them to fight. Keep helping them to understand that there are resources out here. There are, you might not be hearing about them. So often I hear from people that I talk to, Sandra, how come you're the only one telling me this? And as I often tell them, a doctor gets paid to see you. Clinicians are in practice to make money. Then a lot of times they want to, but they don't have, the resources available or the time, I should say, available to help you. So you have to be proactive about, finding out what those resources are. Prior to this year, someone was to say, well, I didn't know, nobody told me, I would understand. But after this year, after February 29th, you have patients that are looking at this, loved ones, caregivers. You have 29 accesses that you can get. And I'm so sorry about that. I stumbled over my words. You have 29 accesses that you can use to enter into a healthy health environment anytime you want. I wouldn't bring people to speak to you, and Talaya is one of them, who will be like, oh no, girl, they call me, I ain't got no time for them. I'm going to charge them. Now, mind you, there might be a charge associated with them, but for them to take the time to just hear what you're going through, to set you up on a path of success during your health journey, they're there for you. You want to reach out to me and say, hey, Sandra, I need help with this person, that person, the other person. If I can't help you, I'm going to do exactly what Talaya just said she does. She's going to work with you until she finds someone that can help you. We understand that, as being African Americans in the healthcare system and being patients ourselves, we understand that our needs, our wants, and our desires, when it comes down to our health journey, a lot of times they're overlooked. I tell people this all the time. Your mouth, your voice, using your voice is the strongest tool that you can ever have to getting access to the best health outcomes. You need to talk to people. You need to find people that look like you, that will understand where you're coming from. Well, you now have access. You have access to 29 of them and counting. There's some that weren't able to be on, that wanted to be on, but you have access to 29 of them and counting right off the bat. So you're not in this healthcare struggle alone. You're not doing this healthcare walk by yourself. As we often say, no patient should be accessing healthcare, going to the doctor, going to the, no patient should be doing this alone. Everybody, we all need somebody to help us, and when it comes down to cancer, as a cancer doula, Talaya is trained to help you. Talaya is trained to show you, okay, this is how you get with me, because I want you on this other side with me. Right? I don't want you, gone. I don't want you, passing away. I want you on the other side with me. So let me show you how you can get on the other side with me. Because you're right, Talaya. So many times people hear on the other side and they automatically assume that you're talking about death, right? Well, she gonna teach me how to die. I don't need nobody to teach me how to die, right? We
No.
don't need to do that. We can do that on our own. We
Yeah.
can do whatever we need, whatever we should be doing. We could do that on our own to help us to die. We don't need nobody to help us to die. But there's where you're thinking outside the box. On the other side is joy, it's happiness, it's peace, it's a love of yourself, it's a love of life again. It's taking you from the point of the glass is half full and it's running out, to the glass is half empty, so it's half full, so you got things that you could work on to keep it from sliding to that lower part before you actually are able to get some help. So we're here to help you. We love to help people, and Talea's the same way. She loves to help people. You could tell her, you could call her and talk to her, cancer related, if it's something with cancer, but it's also, maybe it's a cancer patient that has diabetes. And she's like, well, I'm really not versed in diabetes. She's not going to leave you at the doorstop and tell you, hey, go get some help from a diabetic doctor. Not even telling you what is a diabetic doctor, right? Not even telling you, well, they say I got cancer, but I also got hypertension. I'm just throwing out keywords that are prone in our community, in the African American community. Diabetes and hypertension. They tell you you have cancer and you have hypertension. Do you know what hypertension is? Are you going to Dr. Google and putting in hypertension? And even when you put in hypertension in Dr. Google or Firefox or any other search engines, and you get a hit back, a response back that tells you what hypertension is, what do you do with that language then? Do you really understand what it is? Or are you just reading some words that somebody put out there? And who's the person that's putting the words out there? Is it someone that's well versed in your culture to be able to help you to overcome, hypertension? Or is it someone that's just, all over the place with hypertension? Who's putting that information out there, or who's defining it? Once you get a definition, what do you do with that definition? How do you crunch and break that definition down into something that you can understand? And not so much you can understand, but you and your family that take care of you, right? Or your loved ones or whoever. Do they understand? Because it's critically important that you understand as a patient going through the health challenge, as well as those that are in your internal and external network. Well, when it comes to cancer, Talaya is there. On the other side is there to help you to understand. Okay, well, yeah, well, this is what you read. That's true, but this is how this impacts you. That's true. And while the internet says this, here's some other ways that you can also address whatever other underlying condition that you do have. Because mark my words, if you are diagnosed with cancer, and I don't know anyone that I've met yet that has had a diagnosis of cancer where they also haven't been told about an underlying condition that they really didn't know about until they were diagnosed with cancer. And that's because in being diagnosed with cancer, they run you through a whole battery of tests. Some you've never heard of before. You pick up the phone and say, they ordering such and such. And so do I really need this? Right? Because I'm going to be really honest with you. I've known too many people that have taken tests that your doctor or medical provider has ordered for you that you do not need. But because you don't know better and you don't know Talaya, when you get that cancer diagnosis, you go running and taking all these 1,000,001 tests. You're like, well, I don't know what it say. And then a lot of times you're not told what your results are. You're told good, bad. Okay, what's good, bad? Can you define that for me so that I can understand it? Right? Or are you pushing me out the door? Are you gaslighting me out of my own health? Which is a big word in African American community because that happens so much to so many of us who think that we don't have resources, or who think that we don't have options available, who don't know that there's a Talaya Dendy out here, who don't know that there's board certified patient advocates that look just like you out here, that has been in the field and know what to look for, know how to tell you how to get ahead. It's just too many of us out here that can help you, and we want to help you. We want to be able to help you. This Black Health History Month is all about making sure that our people get the help and get the love that they need from the people who care the most about them, because we're all in one village, right? And we all have to help one another in that one village to be successful and to have healthy lives. Our goal all throughout this month has been and will forever continue to be, stop giving my community access to healthcare. We don't want access. We don't want just access to healthcare. Yeah, Dr. Smith down the street. But if Dr. Smith doesn't have the best tools for us, why are you sending me to Dr. Smith? Why can't I go to Dr. Jones? And how do I get in touch with Dr. Garcia or Dr. Sandra? How do I get in touch with them? Because they have my best interest at heart. They know what I'm going through. They, are excellent in their field. How do I get a hold of them? Right? Nobody's telling you that. You're working with Talaya, you're working with Charms Medi Helps. We'll tell you what those options are. We'll help you find those options. We'll lead you to the water to where those options are, the best options for you that will give you the best health outcomes. I don't even want better health outcomes right now. I want the best health outcomes. And there's no reason why we can't all have the best health outcomes. So I'm going to step off of my soapbox right now. I'm going to say thank you so much to Talaya for coming to us today with this pre-recorded video, giving us the love, showing us the passion, not just showing us the passion, but showing all the people that are looking at this video, no matter when you're looking at this video, I'm giving them the opportunity to understand that there's options, and she's one of them. She's actually, and I'm before we close out, what I am going to do, and I don't know why she was so quiet about this, is I'm going to let her tell you about an item that she has in stock that will actually also help you. And if once again, if you're in need of this information, please reach out to me. Say, hey, Sandra, can I see the link for that show? I'd like to have Talaya come speak for us. Uh, Please reach out. Let me know so that I can send you the link for today's show, and I can also put you in touch with Talaya. But before we go, what I want to do two things. Can you tell us about this product that you've come up with that you wasn't gonna say nothing about?
Thank you, Sandra, for raising that. I actually forgot all about it. Um, so I have what I call affirmation cards for cancer patients and for caregivers as well. And I'm actually working on some other types of affirmation cards that I want to create soon, I hope. But these affirmation cards are positive affirmations for cancer patients and caregivers. Every day you get a different message. And the cancer patient deck has about 35 cards, and the cancer caregiver deck has about 36 cards. So, however you want to do it, but the way that most people use this is they pull a card each day and they really focus on that intention of the card. So, for example, for a cancer patient, you may get a pull a card that says something like, I am powerful in navigating my healthcare journey, something like that, or I am worthy of all the love and care and support that I desire. Just positive things that you can speak into yourself, into your life. They are ways to self-soothe and take care of yourself. Get yourself in that right frame of mind. Start the day with these positive messages. You can also use them as a tool to start journaling. Pull a card and really focus on that message and that intention. Write down, some things. How is that making you feel? What are some goals centered around this affirmation? So, if you were to order some decks of cards for a cancer patient or caregivers, they come in this really nice pouch. You get some other goodies with it. But then also, there is a QR code where you can go to instructions on how to best utilize these affirmation cards for your needs. And I created these cards because, as I shared earlier, one of the things that really helped me was prayer. I created a prayer journal, but then also the meditation and focusing on positive affirmations. I know that they will not solve all of life's problems. Some things, require more attention than that. But if you're looking for a way to really just uplift yourself, to just set the tone, set the message for the day, these positive affirmations are a good way to do that. And you can go to my website, it's under gift shop, and you can order your affirmation cards at any time. And then the other thing I want to note, Sandra, is, for example, if someone would like support, but you don't have the financial means, specifically for people, Black people, African American people who are watching this series, I'm willing to work with you on a sliding scale fee. And reach out to me. We can discuss it more at that time. The other thing that I do have is my podcast called Navigating Cancer Together. The podcast is on all the major platforms: Apple, Spotify, iHeartRadio, you name it, it's out there. And Navigating Cancer Together was created again because I wanted to spread awareness, education, support, encouragement. And I wanted people to know what is out there in terms of complementary therapies that can help support you, ease any side effects that you're having. So, my podcast, Navigating Cancer Together, I talk with cancer patients, cancer thrivers and survivors, caregivers, and then I also bring on professionals who support people in the complementary therapies. So, that is another tool and a resource for you. It's absolutely free. You just pull it up on your favorite podcast app. Like I said, Apple Podcasts, Spotify, even YouTube. And so you can find me there as well. And so those are additional resources. If money is a barrier, as I said, please reach out to me. We can discuss working on a sliding scale fee. So, Sandra, thank you so much for having me, for shining light and awareness on the work that I do as a cancer doula, and also just helping to uplift people, let them know that they have options. My final tip that I think is really important that people overlook is knowing who you need on your healthcare team. That is so critical when you are facing cancer and any diagnosis really. Knowing who you need on your healthcare team, getting those second opinions, checking in with yourself, with your body. How do you feel about how things are going? How do you feel when you talk to your oncologist? How do you feel when you talk to your hematologist? How do you feel? Just check in with yourself because your intuition will never lead you astray. Never feel guilty about getting a second opinion. Never feel guilty about speaking up for yourself. Although we do not have medical degrees, we are the best people to know about our own selves and our own bodies. We are the experts on us. You are the expert on you. If something does not feel right, it is not. Keep going until you get the support and the information that you need so you can take care of yourself. Don't wait a year to find another doctor. Don't make excuses to find another doctor. Oh, I'm too busy. I'm working a lot. I'm helping this person. I'm helping that person. Sometimes you have to put yourself first. Sometimes you have to do the legwork to get the quality care and support and the information and the guidance that you need and that you deserve. And so, with that, Sandra, thank you so much. It's such an honor, a pleasure. This is such a beautiful format, and I just want to thank you for having me.
Oh, you're welcome. I wouldn't have it any other way. Once again, if she's reachable, if you don't have the information, please feel free to reach out to me. Say, Sandra, I would love to speak to Talaya. How do I get to her? How do I get the affirmation cards? Just ask. We're here. We want to help. So please do take the time to ask us. Remember, you only get one life. What you do with that life is up to you. But if you want to live a longer life, you will of course be more than interested in knowing what resources are out there to help you on your healthcare journey. Thank you so much, Talaya. I appreciate
Yeah,
you.
I
Have the
appreciate
rest of
you.
a good day.
You too, Sandra. Blessings to you. Thank you.